Ohio ranks number 2 in the country for opioid overdose deaths, with over 5,000 overdose deaths in 2016-2017. In that time, there were 440 opioid overdoses treated at St. Rita's Medical Center.
Well, our emergency department staff, as well as Lime Allen County paramedics, very much are the front door for our hospital. Our team is highly trained in handling that acute initial emergency from an opioid overdose. All of our staff are trained in administering Narcan, which is the medication that we deliver to fight and combat an opioid overdose. We see opioid addiction and dependence kind of at its extremes. And what we do know is, the patient has to be engaged, willing, and ready to take that first step to recovery. So certainly we provide them with resources, we provide them with community agencies, a plan. Many times the family member of the loved one is the resource outside of the hospital that is helping provide care and support. Family members do have the ability to get education on how to administer nasal Narcan. We do have a few dedicated staff providing a more proactive screen for addiction, trying to, again, catch things early rather than later when it may be too late.
People that misused opioids, up to 70% of those patients obtained those medications from a friend or a relative. So we have a medication take-back bin located in our emergency department lobby. Last year we collected 1,000 pounds of medications.
We began a project called the Opiate Withdrawal and Linkage Program. I think the biggest part that I would like to share is that, the partnership that we have with Coleman has been so valuable to the patients that it almost appears when a patient comes and is admitted to St. Rita's Medical Center for detoxification, they will see a provider from Coleman at bedside the same day. And together we can offer the patient at bedside the beginning of their recovery process. What we think is so unique about this program is that we are truly a seamless system of care. They come into our hospital and are able to see the patient and engage them very early. The patient knows there's hope, and then we are able to get them a discharge plan prior to leaving.
Our ministry at Mercy Health is a calling from our heritage founded by the Sisters of Mercy. We strive each and every day to live our core values of human dignity, sacredness of life, excellence, service, and compassion. Mercy Health devotes significant time and attention to researching and planning ways to address our community's most urgent needs. We strive to do the right thing, to be service-oriented, good stewards of the resources given to us, trustworthy, and responsive to the needs of others. I'm proud and inspired by our team's commitment to the opiate problem facing our community. From our first responders, emergency medical team, treatment program, education, prevention, and community collaborations, we're making progress in providing hope, awareness, and healing. Join us through the Legacy Fund to continue tackling this issue head-on.